Welcome to the Boob Tube, and I am in San Diego, the site of my first clinic, and celebrating 10 years of business with my partner, Dr. Martin Bales, who you might recognize from Truth About Cancer. Now, I have to tell you guys, thermography is not regulated, and that's why I spend so much time educating you. And half the battle is the technology. So I'm going to hand it over to the son of the inventor of the first ever digital infrared camera, and he can explain why the camera is imperative to thermography and what's going on with the other thermography clinics.
Well, thank you, Wendy. It's great to be here. As Wendy mentioned, my father, Maurice Bales, invented the first digital infrared camera in 1979. It wasn't for breast thermography,
No.
It wasn't for body thermography, it was for missile detection over in the Middle East. And it wasn't this camera, that was a couple cameras ago.
Yes, that's important to know, because everyone thinks it's that camera. No,
not quite. So as Wendy mentioned, it's actually quite unfortunate that breast thermography, even thermography in general, is not regulated. Because it's the opinion of the public, and I would think this too if I didn't know.
Absolutely.
That if I walked in to get an MRI on the East Coast, it would be the same as getting an MRI on the West Coast, and it is. Thermography is not like that. We have a lot of clinics out there that are unfortunately buying really inferior pieces of equipment, and like I said, that's half it. The other half, they don't know how to interpret because they didn't study with Dr. Hobbins or at least someone at his level. So the most important thing, much like with a digital camera, a regular digital camera like a DSLR, is the optical resolution. And for thermography cameras like this one, that's measured in optical lines. So the optical line of this camera is 600. That's actually over what the minimum standard requirement is of 480. So the newer cameras are actually quite a bit smaller. Those have been improved as far as size, but a lot of them are actually a lot lower resolution than this one.
Right.
There's a few that are adequate. Of those, we look for what's called an array of 640, which is the horizontal number, by 480, which is the vertical, the optical line.
Thank you for explaining that, because people are very confused. It's very confusing, ladies. That's why I have it clearly written in the book, clearly in the blogs, how to ask. Because unfortunately, when you call the clinic, they kind of will gloss over, because they know we're out there, we're the consumer advocacy group, and they know we're out there educating you. So Martin is going to explain, he just explained what that meant, but what we're trying to explain to you all is the majority of the cameras are only 120 or 240. And I get calls from doctors every week for me to interpret for them, but I just can't do it with the 240. We're not willing to do it because there's a possibility of not having the detail and a possibility of missing cancer. And that's what you're seeing in all these Yelps, is they miss the cancer. Well, is that the camera? Is that how the person was prepared? Because now you have to prepare the person for thermography, and that's a whole other can of worms that we'll get into, so don't worry. And the interpretation. Because interpretation is done in reverse gray.
Exactly.
Not the color.
Not in color.
Colors, I apologize. Color is secondary. The reverse gray, we're looking for vascular patterns in the breast.
Vascular patterns in the breast, not only upon initial scan, but upon follow-up scans.
Absolutely.
Color cannot track the follow-up scans compared to initial, and it's really important to see what's called neoangiogenesis, the new blood vessel growth, and that's only visible in the reverse gray.
Absolutely, absolutely.
One of the major attributes of my father's camera is that it was the first one approved for breast thermography. And that's opposed to many cameras out there that are only approved for what's called temperature gradient or temperature variations. They may be okay to look at other parts of the body, like circulatory patterns in the foot with someone with neuropathy, but they're not at all adequate for seeing the microvascular patterns or vascular patterns, Dr. Sellens has said here, that are required and associated often with cancers.
Absolutely. And this was the first camera approved in 1982. So when you hear of FDA approved in 1982, you're looking at it, ladies, right here. So that's what I'm saying. We're the pioneers because we're the second generation of the brilliant men that brought this technology and this medical interpretation to you.
Very good. You know, it's a shame being in private practice for over 10 years now I work at a large clinic down here in Southern California, and we have a large integrative cancer clinic as part of it. So of course we do the breast thermography there and provide all kinds of integrative treatment, as was mentioned on Truth About Cancer. And I had a woman come in actually just 2 weeks ago from out of state, and she was a big believer in breast thermography. She had been getting breast thermograms for the past 6 years. And we always say we can start seeing things,
Absolutely.
Between 2 and 8 years out, or
Right.
10 years out.
Right.
So 6 is about the average. I mean,
Yes.
it depends on the woman.
Yes.
So everything was clear. Everything was fine on these reports. They were taken with an inferior camera by far. It was very easy to see that. And I don't know who the interpreter was, but they weren't trained. They weren't listed on any of the accreditation or those sites. And suddenly she has stage 4 breast cancer. So not only is she has stage 4 breast cancer, which is obviously quite alarming, but also she had been telling all her friends for 6 years, oh, go get a thermogram. And she was from an area of the country that's not, say, very big on progressive or integrative medicine. So she, over the past 6 years, had painstakingly told her friends to go get thermograms, and then she ends up with this. So she was kind of embarrassed. And she asked me to take an image, so I did. We have a female tech, not me, but to look at it, and it was quite obvious. I said, don't tell me which breast it is, and it was quite obvious which breast it was. So it's just really important to make sure you have the right equipment and right interpreter.
Absolutely. And unfortunately, this is not the first time we've heard this story.
No.
And when you all research this on the internet, this is what you're seeing. And that's why I always refer back to all our websites, all our links, the book, the blogs, because we can usually answer your question. And if we can't, contact us, because we're the dynamic duo.
A very easy way to see when visiting a clinic's website, if they just have the images in color. That's a
Absolutely.
big red flag. It should be, color's fine, but it should be in the grayscale as well.
And the gimmick, full body imaging.
Yeah.
Thermography can only measure the temperature of the skin. It cannot see tissue,
So the only
just
cancer,
the skin.
the only cancer that is approved is for breast, possibly skin.
Skin.
But you could usually see if you have a melanoma with skin.
Yeah.
I get calls almost every week at the clinic saying I want a full body therm.
Yep.
I say, well, what do you accomplish? Well, I want to see and check in on the status of my liver cancer. And I'm telling them, no, I'm not going to take your
Yep.
money.
Yep. I turn away doctors, I turn away patients all day, every day. You cannot see the organs. Ladies, listen to the words coming out of my mouth. You can't see the organs, okay? But you can see the blood vessels in the breast, and that's what makes thermography so amazing as an imaging or screening for breast cancer. Now, Martin does specialize in pain. So you can use thermography in pain, and you can go see Martin for pain. But our clinics are strictly breast because that's what we specialize in. Because we actually specialize in how to treat too and prevention.
And as an addition, screening, as you said, follow-ups, comparing the vascular patterns, and also course of treatment.
Absolutely.
So when we have a new breast cancer patient, we have a thermogram, and they say, "Why am I getting a thermogram?" Okay, yeah, we know you have it. Let's get a baseline thermogram, and then again, using the vascular patterns,
Yes.
the grayscale, the reverse gray, not the color, we can track as those vascular patterns disappear. We know that our treatment regime is working.
Thank you, thank you. And that's what you're seeing. All this groundbreaking research that I'm producing is because when our patients come to us, we have a couple clinics, and when our patients come to us, you're seeing before, you're seeing after, and you have to realize our patients are testing us. They're going to these alternative doctors, and those alternative doctors are saying, use this, use this, use this. And I can show you, is this working? But more importantly, everyone's a little different. So I always say, is this working for you? And I think that's the best way how to look at thermography. How is it working for your breast? And that way it's personalized for you, and that way you're more comfortable with your before and after pictures.
And it's almost an insurance policy against recurrence, because you can image
Absolutely.
after we go from victim to survivor.
Yes,
You can
yes.
image and see and make sure nothing's coming back.
Yes, and don't worry about your baseline. Your baseline's your baseline. We'll work from there, so don't worry about that. Don't worry about a 3-month follow-up. That's with subpar clinics. Don't worry about that. And anything else we should mention?
No?
I think we covered it. Well, thank you, Martin.
Awesome.
It's so nice to see you again.
Nice to
I've
meet
been
you.
gone for a year or two educating you guys. So thank you. And for more information, read the book.